Alright, so what I'm going to do is examine the thoracic spine and ribs. So first I'm going to go through the exam and treatment, but I'm going to do it so that my patient doesn't have to get up and down a million times. So I'm going to do everything that I can in prone, supine, and then do the adaptive positioning in sitting in case it's someone who can't lay in this position or if it's someone like a pregnant individual. So first thing I'm going to do is just assess the spine. So first I'm going to do extension. So I'm going to take my pisiform, start at the top of the T-spine, do a posterior to anterior directed force, and then I can move my way down, comparing each spinal segment relative to the next. Feels like a little more mobility down here. So then next what I'm going to do is flexion. So what I'm going to do is take both my fingers like this, put them on the transverse processes. So as the transverse process, say T7 to T6, T7 transverse process is going to be in line with T6 spinous process. So as you press on a transverse process, it actually causes the spinous processes to gap, creating that flexion moment. So I'm going to go ahead and place my fingers there, my hand on top, bring my arm directly above, and give a PA force to induce that flexion. So just as I did for extension and flexion, I can turn both of them into a treatment depending on the force applied. So I could do grade 1 through 2 if I'm trying to address pain. I can do grade 3, 4, or high velocity thrust manipulation if I'm trying to address any mobility restrictions. So next, what I'm going to do is do rule of the lower finger. So this is where I am placing my one finger superior on a transverse process and my inferior finger on the other side of the spinal column on the lower spinal segment. So for example, if I'm doing T5, T6, my right finger is going to be on superior on the right side, T5, and then T6 is going to be my lower finger on the left side on that transverse process. So what I'm going to do here is I'm just going to assess, make sure my forearm is directly over, and just going to assess for some motion there. So this is rule of the lower finger, meaning T5 relative to T6 is rotating left because the left side is the lower finger. So the next one that I'm going to do is side bending. So that one was rotation, and as I mentioned earlier, you can do different grades of mobilization for that and turn it into a treatment. So the next one for side bending, what I'm going to do here is I'm going to ask you to put your hands, cross them closer together, and I'm going to slide my arm under here, and this table would need to be way higher, so I'm just going to get down on my knees for this purpose. And I'm going to go in between each spinous process. So I'm just going to side bend this way, side bend the other way, work my way up and down the T-spine. So this is going to give me a little bit of an indication on whether she might have restrictions rotating to the left or rotating to the right, and then just comparing each spinous process after that. So I want to make sure I'm not missing anything. So the next thing that I need to do is treatment. So treatment for these two. For side bending, what I would do is find that spinal segment. I would put one hand going down this way, the other hand going up, and I'm going to rotate to be able to take up the slack and create as much tension as possible. I'm going to get directly above, and I would ask the patient to breathe in and breathe out, and then just give a little thrust. The next one, I feel good. The next one I'm going to do is going to have her flip over, which before I do that, actually, I could also get an assessment of the ribs. Don't let me forget to do that other treatment. So I'm just going to kind of see the shape, see how the ribs connect in the back, see if one side might be elevated compared to the other. I could also do some kind of like PAs. Just kind of feel the mobility here. And then work my way down. So when you're doing these PAs, you want to make sure that you're going in line with the ribs. So it's just important that your forearm is in like an obliquely directed force. The next one, you can go ahead and flip over. I'm going to first do, here. The first one I'm going to do is ask you to roll over towards me. And I'm going to put the spinous process in between here. Okay, and flip on over. Alright, so I'm going to ask you to put your hands interlocked behind your head. And I'm going to bring your elbows close together. And I'm going to bring up here until I feel some tension. And I can feel around. And then at the end, typically my sternum would be directly on top of her, but this table isn't good enough for me to get in that position. So I'm going to have my hand like this, and I'm going to be completely over top of where I'm getting the force. Was I missing one more? Oh, ribs. Okay, so the next one that I'm going to do is just assess for the ribs. So I'm going to fall off the xiphoid process. Find where it connects, where the ribs start, and I'm going to make this angle. So I should have about a 90-degree angle, which I do, and that's just checking to make sure that, you know, the sides are symmetrical, one's not elevated compared to the other, and then I can also just give a little bit of compression and relax, just make sure that it has some elasticity to it. So the next thing that I want to do is make sure that the ribs are expanding like they should when she's breathing. So can you go ahead and take a really deep breath? So her ribs should be expanding up, so superior and lateral, and then now collapsing. And good. So she knows how to diaphragmatically breathe, unlike me. And I can see that as her ribs are rising and it seems symmetrical on both sides, and her chest is staying level and flat. So the next, I think that's it for right here. We're going to move on over to this chair. And the next thing that I'm going to do, just try and sit on the edge, if you can, of the chair. There you go. What I'm going to do here is just check for, all these different positions, or all these different passive movements, but just seated. So in case someone's pregnant, or any other reason I mentioned earlier, can't lay in a particular position. So the first thing I'm going to do is just lay my arm across her chest and provide PAs. So I want to get so that my arm is directed in this force and give a little PA. So that's the first one. That's going to be inducing flexion of the spine. So the next one, my computer's, there we go. Next one is extension. So can you go ahead and bring your arm up for me? Yep. And what I'm going to do here is I want to hold her arm so that we're creating a relative extension in the spine, but I'm also going to stabilize right here, so that way when I'm pushing, she's not just going forward. So, something weird, but it'll work. So I'm going to go ahead and give a little PA this way, inducing extension. The next one, she can keep her arms like this, and just relax them, and I'm going to feel in between the spinous processes. And I'm just going to, don't do anything, I'm just going to rotate you to the side. Good. And then move up and down the T-spine. The next one, rotation, side bending. The next one that I'm going to do is I'm actually going to just come under her arm, just so I can create this side bending motion. And I'm going to feel in between the spinous processes and lift my arm up and down to create a side bending motion in her spine. This one's a little more difficult to feel compared to the others, but just going to compare. And then obviously I would do that on the other side. And then all of the rib motions we showed earlier, we could also do in seated. So I can have her breathe, I can palpate the ribs, and just kind of assess that in sitting as well. And that's all.